much for staying tuned to the NTA. My name is Cecil and of course, it is a pleasure that we'll be doing this together. And as usual, this is the Medley show, and we're always here for you. And the idea of this show, as usual, is to discuss anything and everything. And you are very important. You are a very important part of this program. Yeah, last week we talked about your health. Today we will still be talking about your health. And for many of you following us on our WhatsApp page, you realize that today is a very kind of sensitive topic, and we're talking about your mental health. Yes, when we say mental health, we'll look at those people on the road, those ones just roaming the street. Those are the ones that have mental health. Well, gradually, many Nigerians are coming to know that mental health goes beyond that man or that woman on the street who is stripped off his or her outfit and roaming the street. Many people would have one kind of mental health condition or another, and you just may not know it. So on the program today, our business is to educate you on what mental health conditions there are, and how you can know if you or the person next to you is having one of these conditions and what to do. You can send in your questions as usual to our phone line 081 1778 2020. Well, just before we get to meet my guest, who is a professional, someone I've been talking to her, and the very few minutes we've talked behind the camera, she's told me so much. Anyhow, you get to meet her right after we take this feature. We went on the street and we sought to know from people what they understand by those with depression, what they understand by depression, and if they've met any of such persons. And this is our finding.
Knowing when somebody is depressed is actually a dicey situation. It's not something you can tell, because in my own case, I've actually met somebody who was depressed and actually attempted suicide, and she's actually a very happy person. You know, she's not just the kind of person you would suspect is depressed and all that, but and she didn't give any signs. There was no signs at all. I was talking to her one day. The next day I heard she was in the hospital. And so for now, thankfully, she got help early, and it wasn't as bad as she had hoped, because she actually wanted to end it all. So for now, what I do is I try as much as possible to talk to her on a regular basis. And even if when she says, I don't want to talk, I tell her, I give her a timeline. I'm calling you back in the next 10 minutes. I don't want to know. I know that I will talk to you. And I have numbers of her neighbor. So if she doesn't pick my call, and I know that she's supposed to be at home at that time, then I can call the neighbor to get help for me.
I can't say I've actually met someone who was depressed per se, but I think that depression generally is a thing that happens when people are like withdrawn from people, or let's say abandoned, because everybody needs somebody to talk to, because in life you always have things that offend you, or things that actually push you to the brink. So if you don't have someone to discuss with, to air your mind, most times you're pushed into a point where you end up being so pained that you might actually end up hurting yourself. So, and mostly pushed into depression. So I think, even though I've not actually met someone who was depressed, but I hear the stories of depression that leads people to suicide, etc., I think that the best thing to do is everybody needs somebody to talk to. So it's always good for people not to hold things in their mind. And if you have a friend who you see is withdrawn, it's always good to ask the person what the problem is, because you might be helping the person. That's just what I think.
The major characteristic of a depressed person is bottling up things and not wanting to associate with people anymore. It's like a withdrawal tendency, where someone doesn't want to talk to people, just wants to be alone. So that was like the major, let's call it a symptom, because depression should be a disease or it should be a sickness. Yes, so withdrawing and bottling up. Those are like the major things about depression. And that's what I found with that person.
So how did you now later help the person out?
Okay, well, we had to push. I and my friend, we had to push this person to talk. You know, there's a way talking and letting out emotions releases you. I don't know, maybe it's God that created that. When they say people should not cry, when people cry, you feel relieved. Yes, so we had to push him to talk. Whatever it was, he had to talk about it. At least talking about it helped him to, when they say a problem shared is half solved. And that was what happened. And we rallied around and helped in the little way that we could. And God so kind, he came out of it.
All right, that's it's good to know that many people are actually know about these various some of the mental health conditions, especially depression. Anyhow, just like I said before the opening, before that feature went on, you will get to meet my guest. And my guest, she is the country director of Reconnect Health Development Initiative. And she's also, well, of course, a mental health physician and advocate. And there's something else I saw about her, call her a sleep physician. Please help me welcoming Dayyabah Shaibu. Thank you very much for coming around. Sleep physician, seriously? Like, someone actually helps to sleep?
Oh, that's right. People have a lot of sleep issues. And, on the average, people just go get Lexotan or Valium, just because they're struggling to sleep. And for some of them, that's the beginning of dependence on the sleep tablets. But there are several sleep conditions apart from insomnia. Insomnia is, inability to fall asleep or stay asleep.
So someone will actually call you and tell you, I can't sleep, and you start.
So we run a full-blown sleep clinic.
Wow.
We diagnose what sleep disorder people have and manage it.
Well, okay, that's a good one. I'll be a very terrible customer because I can sleep very well. All right, so thank you very much once again for coming around. Now, let's start with the very common. I talked about many mental health conditions that we don't know about. I know we have depression is the most popular. We have anxiety. Anxiety is there is bipolar, there is schizophrenia, and several others. Which are top 4 or 5 common ones would you say we have around?
Okay, so first of all, I think I always like to give a background, to say what mental illnesses are. So as human beings, we have 2 aspects to our life, isn't it? To our health. So we have the physical health and we have the mental health. The physical health is the one that everyone can relate to, things we can see. It's physical. Oh, I have a fracture. I can see someone in pain, physical pain, abdominal pain. Someone is stooling, someone is vomiting, someone has a fever, someone has high blood pressure. That's all physical health. So mental health has to do with the aspect of our health that we can't see. So how we feel, how we relate with people, how we behave. So that's mental health. So anything that affects our behavior, our thoughts, our emotions, is an aspect of that is a mental illness. All right. So these mental illnesses, we have the psychotic illnesses. That's where things like schizophrenia, fall.
As much as possible, while you explain all this, please speak in simple English.
Yes, exactly.
Okay.
So I'm just categorizing and I'll break it down.
Okay.
So for psychotic illnesses, they affect how we behave generally. They affect how we think, how we see the people around us and our environment. So I'll just give an example as schizophrenia that you mentioned. Then we have the mood disorders. These are conditions that affect our mood. So am I excited or am I sad? That's mood, isn't it?
That's mood, yes. That's mood, and that's not supposed to be...
Fantastic. No, mood is what we have.
Yes.
So the illness is what affects our mood.
That affects our mood, okay.
Do you understand? So mental illnesses, I put it this way. We have several vital organs in our body, isn't it? So we have the brain, we have the heart, we have the kidney, we have the liver, right? We have the stomach, we have the intestine. So everything that affects these other organs, are part of, physical health. So they are physical illnesses. But what affects the mind? If I ask you, where is our mind?
My mind is here now.
Good. So
I
where's
see.
your heart if your mind is here?
My heart is under
Good.
here.
So the mind is actually here.
The
It's
mind
the
is
brain.
here, right?
That's right. So, that's why, people do, make these gestures that we usually don't like when they say, are you okay?
Yes.
That's the mind. But, most times on the average, just say, my mind just caught.
My mind just caught,
But
yes.
that's your chest. The mind is actually what controls your mood, how you feel, your emotions, your behavior, because that's the powerhouse, that's the engine. So for mood disorders, they affect how we feel, whether we're sad or we're excited. So I always give an analogy and say the normal mood, imagine a straight line, right? So that's what the expectation is, that our mood should be balanced, right? There's a straight line.
Okay.
So anything that is below that mood is depressed. When you depress something, it's low, isn't it? Anything that is above that line is elated. So it's elevated, isn't it? So depression is an illness that keeps someone below for a period of time, which I'll define, in a few minutes. The opposite of depression is what we call mania.
And that's
So
also a
someone
problem.
is elevated, yes.
And that's also a problem.
Yes. But it has to be out of context. Because being sad is a normal emotion. Being excited is a normal emotion, right? So if I lose my phone, I'll be sad.
Yeah.
If I lose someone, I'll be sad. If I'm scolded by someone, I will be sad, right? If I won a lottery, I'll be excited.
Yeah.
If I was given a gift, I'll be excited. So how do we know if this has gone out of context of normalcy? Right. So that's where we use what we, use to diagnose mental illnesses. So we have our diagnostic Bible, for lack of a better word.
Okay.
So we have the DSM-5 that was formulated by the American Psychological, Association.
We can actually see it online.
Yes, it's there. It's
what?
DSM-5.
DSM-5.
Yeah, so DSM is Diagnostic Statistical Manual.
Okay.
5 is the version 5.
Okay.
That's
that's the updated
current,
one.
Yes. Then we have the ICD 11, International Classification, for mental disorders. That's by the WHO.
Okay.
11, right?
Yeah.
So most people that train like in the Americas use the DSM-5. So it depends on which one you're trained with. You have the ICD 11, usually Europe and
Okay.
all that. So
Let me just call our phone numbers because we have messages already coming in, and please, you can be part of this. Ask your questions as regards mental health, as regards depression, or whatever it is, or you want to share something with us. We are open. All right, our phone number is 081 177 82020. You can call us. You can send us a message. Please, no, don't call us. All right. My name is Isaac Stephen from Makodi. Can phobia cause anxiety? That's that question. Then let's take one more. Then you take them together. And this person says, good afternoon. I am Longer Emmanuel. Does smoking affect someone's mental status?
So am I supposed to
Yes,
answer the
please.
question? Okay. Yeah, so phobia is grouped under anxiety disorders. I have not finished listing the different types. So phobia is a form of anxiety disorder. So phobia is like a morbid fear of something. So there's something that we call panphobia. There are people that have phobia for everything. They're not very common. So we have germophobia, people that are afraid, that have a phobia for germs. So you find them, being excessively careful. We even have people that have phobia for sex. I've managed a patient who had been married for a number of years who has not been able to consummate in marriage because there is this intense fear. And it's not something that you just tell someone, snap out of it. It's someone that needs to be treated with, anti-anxiety medication, psychotherapy. Yes. So phobia is because it affects how you feel. So I think it's a good way for us to see these things. So mental illnesses are things that are there. They are illnesses that are treatable, right? So if someone says, do you have a mental illness? No, I don't have a mental illness. So what's the difference? If I say, do you have a cardiac problem? If I have high blood pressure, I have a cardiac problem, right? So if I have a phobia, I have a mental problem. But over years, it has been turned to an insult.
Yes.
And that's why before you diagnose someone with a mental illness, you need to be certain that the person meets the criteria. using those manuals that
you talked about.
Because if you came to the clinic, for example, and you say, for example, I'm bringing someone because he's behaving abnormally. What is abnormal to you might not be abnormal to someone. How you dress in a certain place might not be odd in a certain place. So it has to be in context, of the person's, belief, socially, culturally, religious, in keeping with the social.
The person that asked about smoking.
Yeah.
Is asking if smoking can cause any kind of mental condition.
Yeah, so smoking is okay, let's start. Smoking what now?
Good. Smoking what? Good question. Smoking what? Please.
Because
okay. Let's
just talk about the different things people can smoke. We can talk about cigarettes, right?
Yes.
People smoke mushrooms, people smoke cannabis, people smoke cocaine.
Okay.
Do you understand?
Yeah.
Heroin. So it depends on what, but generally all these things I have listed belong to a group called psychoactive substances. And what are these? Psychoactive substances are things that activate our central nervous system. So they affect our mood. They affect how we behave. They affect how we feel. So do they affect the mind? Yes, they do.
Okay.
So people use these things for various things. Some people will tell you, for every time I eat, I feel nauseated unless I smoke. Some will tell you I use it to calm down anger. It makes me relax.
Is that a problem?
Well, yeah, because initially you're using it to solve a problem seemingly. Then it gradually progresses to a stage where you're unable to do anything unless you get it. So anything that is psychoactive, that belongs to a group of psychoactive substances, has a potential for addiction.
Okay.
You understand? That's why it's not everything that one can get addicted to. It has to be psychoactive.
Okay. I would have taken more questions, but you keep calling the line. Please don't call the line. Just send a text message or a WhatsApp message, and be sure we'll read your message. Meanwhile, while our crew went out, we caught up with some persons who have actually had one form of depression or another. I think one of them actually had at a point contemplated suicide. So they had an exclusive with the Medley crew team, and you want to hear the story? Here it is.
First, I will talk about how I got into depression first. It was in 2015, I can remember vividly. I used to smoke. I used to smoke with my friends. So that particular morning, they came in with smoke. And after hitting that particular blunt that day, it felt different. It felt different. I could not recognize myself. I felt like something had happened to me psychologically. It happened that I started to have funny symptoms. It felt like I was the only person existing in the world. At the time, it felt like everybody else was existing and I wasn't existing. It was a very complicated situation for me. I had to go for psychiatric treatment a couple of times. But here's what worked for me. At the time, I kept on thinking about this stuff because I know I wasn't me anymore. I kept on thinking every day. I was always thinking about it. How do I get off this? How did I get into this situation and all that? But I started to tell people the story, and that's how gradually I could see myself recovering. I could easily meet anybody and say, "Wow, this is what I experienced so time," and we'll laugh about it. We'll laugh about it. Guys normally we laugh about it. And so I found that it was working actually. I could relate to people about my situation. They would give me an advice or they would laugh at me, but all the same, it was working out for me. So that's how I was getting off that particular situation. I was becoming myself, and thank God I'm back to myself.
My depression was due to, for financial reasons, and certain times in my life when things were so rough and turbulent. And because of my reserved nature, I couldn't share with people what I was going through. And because of the way I was raised, I practically raised myself. And so it was difficult for me to just walk up to someone and say, okay, this is what I'm going through. And so that led to depression. And at some point I was suicidal thoughts were coming in, and I almost did it. I remember as an entrepreneur, I run my own personal business in the printing industry, and things weren't moving fine. And so I felt I should just I applied for certain, grant opportunities, and it didn't come true. And so at some point I just felt, hey, there's no hope for me. Let me just end it. And I was actually making plans to do that. So until with the help and intervention of God, I got someone who just came in out of nowhere and just felt, hey, guy, you're going through something. I could sense it on you. And so the person decided to just, offer a counsel. Hey, young man, why don't you just talk to some people who could just, help you with certain counsel or probably assist you with certain things. And I took it. I discussed with people with one or two persons I feel I could trust. Because depression in itself, if you can't, to come out of it, you need someone you can trust before you can. I can't just open my mouth and meet you because you're my family member and say, I'm depressed, I'm going through this. Because you also, the person you want to talk to may be going through, and there's nothing as frustrating as you being in a challenge and then going to approach someone to help you, and the person is also probably going through worse. So the person is unable to offer you the needed help. And so that even tends to increase the natural tendency to want to succumb to negative vices, like killing yourself or just doing something harmful to yourself. So, but eventually for me, I took my time to talk to people who I feel like one or two persons I could trust. They counseled me. I prayed, and then I got a divine help at that time, and to the glory of God, I was able to come out.
Well, one thing is admitting you have a problem or a challenge, and another thing is coming out to say it. It's really bold, and someone who has been bold to actually come up to tell her story, and has she's called herself a face and a voice for those with mental. I don't know. She'll tell us about it. Anyhow, get to meet my second guest. She is the executive director of She Writes Africa. She's a mental health coach or advocate, like she would like to call it. Hauwa Ojeifo. Hauwa, thank you very much for coming around.
Thank you so much for having me.
Yes, hearing those people tell their story, but I was looking at the visuals earlier today, I just remembered you. So just a quick recap of your story. And yes, what was you had bipolar? Yeah, just tell us, give us a quick recap, because people would like to hear your story and, and pick it up from there.
Yeah, sure. Thank you so much for having me. I am the executive director at She Writes Woman, and the organization started from my story, really. And that was when I got diagnosed with bipolar and post-traumatic stress disorder.
Wait, now, how did you know? What was wrong with you? Did you on your own or someone, did you just go there or?
So I like to tell people that, honestly speaking, I feel like mental health challenges, the first person to know is the person who lives with it. And I know a lot of people tend to feel like, no, not really. I strongly believe that you know that there's something off, for a while. It's just that because there's a lot of noise within the environment with regards to, spiritual issues, or maybe you're not eating well, or exercise well, it must be the stress, Jerry. Don't worry, once you get money, everything will be all right, things like that. And when you don't particularly, it takes a lot of time. I have to say, from the moment I feel like I had the onset of my symptoms is about 8 years to when I got diagnosed.
No way.
Oh, yes, and actually,
you were denying it. You were actually denying it to yourself initially.
I don't think I was denying it. I just think I didn't know what it was. I didn't know what it was. So eventually it got worse to a point where I had suicidal ideations. And then that's when all of a sudden it was, okay, I think I need to deal with this. And by the way, I did all of this by myself initially without telling family or friends or anybody, because I couldn't process what was going on inside of me. So I just went to a psychiatrist. I remember going to Dayyabah Neuropsychiatric Hospital. Dayyabah left by myself to go and see somebody. And then after 1 or 2 or 3 sessions, I went broke because I wasn't the person on the personal time, so I was paying a premium. And then I was like, okay, you know what, I've gotten everything that I need to get. And about 2-3 months after, I had a near suicide attempt. And then, that was when, for me, it was, okay, family has to get involved, because this is getting really serious. So I got diagnosed with bipolar and post-traumatic stress disorder from my previous domestic violence and sexual rape experience. And so I started taking medications, and I did therapy in and out. I'm still on medications, even though that was like, 5 years ago. But yeah, it's been a journey.
So someone who's a therapist can actually be actually having the same problems and symptoms.
I mean, mental health is something we all have. We all have a mental health, and it's just about, life happening. So whether it's biologically, socially, something is happening within your environment or within your biology that is interacting to either make or reduce your state of mental wellness.
Okay, now let's break this down. I'll come back to you, Doc. So let's break this down a little. Bipolar, schizophrenia. Explain this too.
Oh, okay. So bipolar is a very common mental health condition, actually. Aside depression and anxiety, I think bipolar comes a close third with how common it is in our environment. It is pretty much a mood condition that oscillates between, highs, immense highs, and then very low lows. So the highs are usually hypomania or mania, where you have this inflated sense of confidence, you have a large appetite, you're talkative, feelings of grandiose, energetic, you're full of energy and all of that. In my own case, sometimes I'll go like 3-4 days without sleeping back then. And then, and of course, because you're doing that, your inhibitions are down. So all of a sudden, things that you used to care about before, all of a sudden you're very carefree, you're very out there. There are other sort of symptoms that come with that, hypersexuality and things like that. And then when you're low, it's almost like it's such a contrasting difference between this high person that everybody's like, oh my gosh, I like your spirit, you're the life of the party. Nobody really catches it then. Because it feels like, oh yeah, I'd like to be happy like her. And then when you now go down, it's like, oh my gosh, did I do all of those things? And, that's where you have the depression that really comes in. That's where you begin to have those feelings of worthlessness, hopelessness. And in my case, it went all the way down to suicidal ideations. But schizophrenia is different, because now you're talking about auditory and sometimes visual hallucinations and things like that. So it's a bit more further down.
Okay, doctor. All right, let's just take some questions. Before I'm sending questions, I'll take a couple of these questions and see how we can run through them, because we'll have so many. Can alcohol cause depression? Well, I think it's similar to can smoking cause depression. What are you drinking? Okay, so good afternoon. I'm Wisdom from Imo State. Please, does phobia have any positive effects? Hello. Well done, doctor and presenter, for bringing this important program. My name is Ibrahim. I signing from Port Harcourt. My problem is too much drinking water and too much urinating. Seriously. Okay, well, I was too much. Okay. Hi, hello, Cecil. I am Uzoma from Nigerian, based in Cameroon. Can heavy and continual depression lead to madness in the long run?
Okay. That's interesting.
Interesting. Sorry, just not to minimize the other question on drinking water. And I think the person should just get tested. It might just be the first sign of diabetes. Polyuria, polydipsia is a health thing, just so that we don't...
But not mental.
Not mental, not necessarily mental, right? So the question about can long-term depression cause madness? I always like to say that in mental health, you try to avoid that word, madness. Just the same way we don't have a stigmatizing term for people who have high blood pressure or diabetes. Why, who coined the word madness in the first place? I think it didn't come from a good place. It was, derogatory. So we prefer to say mental illness. So I don't know exactly what the person means by madness, but on the average, people consider roaming on the street, eating from the garbage bin,
madness.
Being wandering, those are the things they call madness. But generally, it's the psychotic illnesses. That's where schizophrenia, fall. So I think it's an indicator of how severe depression is. So people can have clear-cut depression, that's persistent low mood, low energy, loss of interest, feeling of hopelessness, worthlessness, low appetite, low self-esteem. That's depression, right? And this has to have been going on like most of the day, every day, for at least 2 weeks without intervention. So some people will have it just clear-cut depression, and sometimes in severe cases suicidal ideation, like Hauwa mentioned. In some cases, people might have additional psychotic symptoms. So they start to hear voices, they start to suspect that people are after their life, They start to neglect personal hygiene. They start to attempt to roam the streets.
Okay.
So now those are psychotic illnesses, and it's an indicator of severity of depression. So it's not necessarily that depression is causing that. So they're existing together.
Yesterday someone was telling me that we're discussing this topic, and he said he has a friend who said that he would just be driving and something will just tell him, move your car this way, just hit those people, or just go into that bridge. I mean, it's really it's shocking when I hear things like that.
Yeah, but I think it's also very important for us to, paint a broader picture around it, because on the one hand, there are people who have these conditions, but the reason why these conditions go to this point of severity is because there's a lack of care very early enough within the system, Nigerian healthcare system, and those social welfare and things like that. Because ideally, you would think that when people have the onset of any mental health condition, generally, they're able to go to the closest healthcare facilities. Ideally, that should be a primary healthcare center, but we don't even have that mental health care support in primary healthcare services and things like that. So whilst people are living with it, the reason why they are at that place in terms of severity is because first, we don't even know what people are dealing with, so there's that bit of ignorance and under-awareness with regards to mental health, and then number two is they don't know where to go to. And then of course there's stigma, because when you think about all the words like madness, and nobody wants to be associated with that.
All right, let me stop you here very quickly. We'll take when we get back, I want to talk about the Lunacy Act. I know you went to the National Assembly, and in fact, I think you must actually be comporting yourself, because you are almost going to bring down the place if they have left you. Anyhow, we'll take a small feature, and okay, we have a skit actually, and this skit is something on aggression and how to get to manage it, and we just put this together. I thought you'd like it.
Aggressive behaviors can sometimes be as a result of how one was raised. People who grew up witnessing aggressive behaviors are more likely to become aggressive. Other factors like alcohol, drug abuse, emotional disorders such as anxiety and depression can also play a role. Aggression is an act towards another which may not be intended to harm but leaves a negative effect.
I want that.
Where's my money? Like I didn't carry it, Abby. Oh my God.
I'm so sorry.
What is
so
wrong with
people?
I'm really sorry.
Are you crazy?
I'm so sorry.
Why did you push me? Are you blind?
I'm sorry.
Excuse me. She has eyes and she matched me.
I'm really sorry.
You even pushed me at the same time.
I'm so sorry.
Aggression can be verbal as well as physical. Using insultive language, yelling and screaming are all examples of aggressive behaviors.
Hello?
No.
What version?
It's not mine.
It's 99.
At your own risk.
Sit down.
You're just so annoying. Gosh. What is happening here? Are you serious? Give it to me. It's not yours. Rubbish. Now go and buy your charger.
Although the negative outcome of physical aggression is more obvious, intimidating or verbally berating another person could have adverse effects on its victim.
Are you done? Are you done numbering the mics?
I haven't done that.
Excuse me?
Haven't done it.
For how many hours?
Easy. I was doing something else.
Doing what? What have you? Okay, show me. What have you been doing?
The camera.
I told you to do something for over 1 hour, and you're still here. You guys are so stupid.
Oh,
you are so stupid.
Director, take
God,
it
these
easy.
people get on my nerves.
Take
Give
it
it to
easy.
me. Give it to me, and get out of here now. Get out!
Take it easy,
Rubbish.
Director.
Don't. I'm fine. I'm calm.
All right.
I'm okay.
Thank you, ma'am.
I'm okay. I'm fine.
When dealing with aggressive person, provide a listening ear, seek to understand them, put yourself in their shoes, be assertive and offer advice calmly.
Hey, my dear, how you doing? Why are you sitting alone?
Nothing.
Are you sure? What's bothering you? Talk to me.
I'm fine.
Are you sure? Okay. Oh. Well, I noticed that you've been acting strange lately. Oh. Look at the way you shouted at that guy because of your charger. And even also, look at what happened at the studio. What's wrong? Why are you acting that kind aggressive these days?
I don't know. I think I've been going through so much, and I've been allowing those things to rule me. I don't know.
Okay.
And I don't...
Don't worry. Just, I understand. I know you're not a bad person, but then you have to calm down when talking to people, okay? So that you won't be aggressive in that, okay?
I will. And I will need your help in that.
Yes. I'm always there for you, of course. Yeah. All right. Thank you.
Well, that's a pretty nice skit. Just trying to show you examples of different aggressive behaviors, and sometimes just talk about these things and you'll be fine. All right, I have two guests with me in the studio, Hauwa Ojeifo and of course Dr. Dayyabah, and they are mental health practitioners. I have many of your messages. You were trying to say something. Can you quickly drop your thoughts then what you were saying, and of course talk about the Lunacy Act and the National Assembly that I went to address. Lunacy, that word is not even...
I know.
Okay.
It's so archaic, outdated. There's everything wrong with it. I'll just speak up from there. So Nigeria's last mental health legislation was really part of the Lunacy Ordinance of 1916. And then it was put together, and then the power was given to medical practitioners and magistrates in 1958 under the Lunacy Act. And of course that makes sense when you look at everything that's happening within the mental health space in Nigeria, from people being abused, chained, shackled, beaten up, restrained, police officers being involved in things like that. The thing is that we look at those things and we've normalized them, like, oh yeah, it's just mad people, just bundle them up, but that's not how it's supposed to be in an ideal working environment. People with mental health conditions are people that have rights, and they're people who should be, treated with care and support, and the environment should be made to adjust to the kind of needs that they have. So really what I did representing my organization at the National Assembly was to testify as the first person with a mental health condition to really testify in that capacity, because I think a lot of times when we think about mental health, people are always making these decisions for us. People are in the room deliberating about people with mental health conditions without people with mental health conditions being in the room to actually say, this is what support looks like for me, this is what a good legislation looks like for me. So we're really just holding Nigeria accountable to some of the commitments that the country has made internationally, and just ensuring that whatever the bill was, it was in line with international human rights best practice, and it was a success because the bill was stepped out. So yeah.
Okay, so all right, let's take a few messages and then we'll get back. This person is asking and someone else is calling. Okay, all right, sorry, I also hear voices. Okay, I dropped out of school and I'm broke and now I'm drunk. I hear people discuss me to be mad. From Makodi. Sorry, I also hear voices at night and it's as if people don't like me anymore. They say I have pride just because I love my privacy. This person is writing from Makodi. Okay, let's take another one. Hello, I'm Amina, and I believe I'm depressed ever since I lost my sister. I became distant from people, and I'm short-tempered and also absent-minded. Because sometimes when people are talking to me, I don't notice. I'm also emotionally and mentally exhausted. I want to do anything. I need your advice.
I'll say Dr. Dayyabah should take the first part of the other question.
Take the one of the mood.
Exactly.
Right?
I was going to do that.
Very in tune with the mood thing. So
yes. So let me talk a bit about the mood and just touch on the others, and I'll leave Dr. Dayyabah to really deep dive into the science of it. Really, there are triggers, whilst some of us may have predispositions, biological predispositions, that is, genetic factors or other social factors that have layered over the years and predispose you like. So it's just kind of like the straw that broke the camel's back. So life is happening. You had a loss, maybe you dealt with abusive parents, maybe you had the breakup. All of these things affect your mental health as you go on. And the more they hit you, the less resilient, or the more your resilient threshold begins to weaken. So what happens is that something comes up, or maybe a loss, or like, you know, the lady that talked about losing, you know, a family member and all of that. And that comes up and then it just shatters everything. So now you're at a place where maybe you're dealing with clinical depression, maybe it is an acute case of depression that maybe you need to deal with. So I think it's important for us to look at triggers of these things, because they don't just come like,
so what should she do?
I think first off, the good thing is that she's aware that, you know, it started, you know, after something, after loss. So she's aware that there is an element of grief and loss and pain that she's trying to process as well. So it might be very helpful for her to speak, you know, maybe first with a counselor, but maybe therapy will be needed, you know, along the way to be able to process the emotions that come with pain. There are also certain self-help, but I'm always very wary about putting self-help first before any form of professional support, because we're in an environment where when somebody says I'm dealing with something, it's chances are that they've been dealing with it for years. So there's an accumulation, and so you don't want to give self-help for somebody who is already on the edge. You know, you want to give them what can pretty much take them away from the edge first, and then give them what they need to do. So I think she needs to do a lot of grief counseling, and then also a bit of therapy as well. And
Up your sites, I guess. Okay, well, before the end of the program, we'll talk about, we'll drop your handles so that people can actually visit.
Yeah. So I think, just like Hauwa mentioned, I think the best advice is for her to speak to a professional, because that way there's no sentiment, there's no emotions involved. Is use of evidence, you know, and objective assessment tools to be able to place her where she is, and then what she would need, basically psychotherapy, and then she'll be able to, because you never can say from the message, is she moderately depressed, you know, is she severely depressed, is she someone that will need medication, is it, because someone can just say it and it sounds, she just said it casually, but the person is not saying it exactly how they feel.
So anyhow, I guess we'll have to see a professional, and maybe if anyone around where she is. The guy from Makodi who says he's now a drunk, people say he's running mad and all.
Good. So the thing is, are people saying it, or is he feeling like people are saying it? So with psychotic illnesses, we perceive things that are not actually there. That's what we call hallucinations, right? And delusions, right? So for some people, for example, schizophrenia is a big name for mental health condition. So the average mentally ill person that roams the streets, that is dirty, that picks from the garbage, that talks to himself or laughs to himself, more often than not has schizophrenia, right? So the schizophrenia has different types. It means there are hallucinations, so the person hears or sees or tastes things that are not there, or even feels. So the five senses. I hear things that other people can't hear, that are not there, or I see things that other people can't see, or I taste things that other people can't taste, that is not there, or I smell things that are not there, or I feel. You actually come across patients that will tell you that there is XYZ in the room. They will describe the man or the woman that they're seeing. Sometimes they will tell you that person is having sexual intercourse with them, or is talking to them, and they're actually having conversations. So all you see is Dr. Dayyabah talking to some imaginary persons, and the people will be so convinced that this person is there.
Okay.
Right?
Yeah.
Sorry. So I just needed to explain that. Is it that people are actually saying it, or is he assuming? So he might be paranoid because he has mental illness.
That's still the problem.
So is he using alcohol to cope with the way he feels? Or is it alcohol that is making him behave that way? So there's a lot, you know, there's a lot to do when you're assessing, because, you know, just from things like that.
Something I will lay clear here now, we can't actually diagnose this thing on TV. Yes, most of your messages. So what we'll be giving may be just some general. Your case may be a little specific. Let's take a few more of these messages before we run out of time. Please, I need your advice. I'm emotionally connected to someone. Have I taken this already? I need your advice. I'm emotionally connected to somebody who I'm seeing in my office every day, and I don't want to go beyond company's policy. Please advise me on how to manage myself and avoid depression over that. And how do I remove my mind from her? One, greetings to you, Ma. Please, I want to know if depression can be overcome without discussing what you're going through with someone. Oladimeji from Ikorodu. I love your show. and I follow. Okay, does sex cause depression?
Interesting.
Let's.
All right. I'll just start. I'll take it from behind, and then I'll just leave the rest for you. Sex is very unlikely to cause depression because of what happens in the brain when you have sex. If anything, sex is typically what people use to cope with depression because it elevates your mood. It really releases endorphins and all of those things in your brain. You know, the whole bonding activity also helps you with oxytocin, especially as women as well. You know, so that is definitely something. Now, there are unhealthy ways of using sex to cope as well. You know, so that's something that we want to be very mindful of. And then as for, there was a question right before that.
The attachment with the
attachment with the colleague
yeah.
at work. I think it's interesting, again, because we don't have a full picture, so it's very limited in terms of what we can say. But I think, you know, one thing I always say with regards to mental health conditions is that whenever we think, as Nigerians, whenever we think about mental health, we always think in terms of illness. There's something wrong, you know, is this label? I don't want it to be this label. But we forget that all of us have mental health. And sometimes there are stressors, you know, that we may have in the short term that we need to deal with. And sometimes it could just be that we need something more in our toolkit, like, you know, we need a lot more emotional intelligence. We need to be more regulated around issues of rejection or not getting what we want or attachment or detachment, things that are usually rooted in family dynamics and parenting, you know, dynamics when we're younger that we need to now begin to address how they come up as adults. So there is a lot of, you know, I wouldn't say, oh, speak with a therapist or anything. I do need to just emphasize that every single person listening needs to begin to realize that we all have a mental health, and that you go through challenges does not necessarily mean that you have this illness. It could just mean that there is something within your mental wellness toolkit that you need to build, whether it's emotional intelligence, regulation, or anything like that.
You just take quickly the one, if he doesn't need to discuss with somebody.
Oh yes, that. Again, this person, was the person actually diagnosed, or is this a self-diagnosis? So that's number one, because we also need to be very careful because this is public information, so we don't want people to just run with things. And then there are different types of therapy. So therapy as itself, you know, a lot of times when we say therapy, we mean psychotherapy or cognitive, you know, behavioral therapy, but there are lots of therapy: art therapy, light therapy, music therapy, dance therapy, you know, emotional freedom techniques, neuro-linguistic, and, you know, all of those things that cut across different areas of whether it's pseudoscience or the core sciences or anything. And so, yes, there are types of therapy that involve you not particularly relieving. And that's not to say that you would not narrate certain aspects of, you know, what might be causing the depression, but you may not have to relieve it in a way that re-traumatizes you. But it's not very mainstream as well. So that is more of a traditional type of therapy. But if the person is worried about fear of confidentiality and things like that, then I would say you just need a very good mental health practitioner to work with you, somebody you can build trust and relationship with, you know.
All right, we have so many messages, and we'll have a feature on suicide, but I don't think we can take that, so let's take more messages. Please, I'm depressed. I'm depressed, and I delivered through CS, and after 6 months, I'm pregnant again. What should I do? This person said, Assalamu alaikum, my name is Ibrahim. I welcome Doctor. Doctor is welcoming you to the program. Okay, please, what is the cause of ovarian cyst and how can it be treated? Let's stick with, we have so many questions on our topic, so we can answer that later after the program. Good afternoon, it's Miriam. I want to ask, what type of drugs should you give to someone that is smoking? Please, what is the cause of forgetfulness and not being able to retain vital issues? Let's take those ones very quickly.
Okay, sorry, the first one.
The first one, the one that says delivered through CS.
Oh, okay, she's depressed. So that's, yes. You know, that takes us back to what we're saying. Depressed could be, am I worried? You know.
And she's pregnant again.
She's pregnant again. So it comes across as worry to me. So I think we need a lot more information, you know, to know what's, naturally you'll be worried. I delivered through CS, how long ago? 6 months ago. And there's a lot of things, you know, that are going through her mind.
Touch a little bit of postpartum.
Yes, I was just going to ask. That's the one that when you don't like to see your child. I think there's
sometimes so there's postpartum depression. There's the postpartum puerperal blues. There's the puerperal psychosis. So these are mental health conditions that happen in relation to childbirth. So because of the change in hormonal balance in the body. So it happens for this patient, just so that she knows she needs further evaluation for us to know what's going on. And just like Hauwa mentioned, we need to normalize talking to people in terms of therapy, right? Therapy does not mean I've gone cuckoo, like people say it. So I can decide to book a session to talk to a professional because I just need to resolve some conflicts I'm having within me. I'm trying to find answers to some things that are not clear. I was brought up this way. I had this relationship with my mom or my dad, and I just can't seem to get past that place. We need to be able to normalize going to therapy like we normalize going to the gym, right? So it is a good thing. It's about you getting better. I can decide to book a session and say, I just want to work on my emotional intelligence. Or I just found out that I have boundary issues. Everyone that just comes, I give my time and I'm unable to cope at work. All right?
Okay.
And then the next person talked about something.
Forgetfulness.
Yeah, it could actually be different things. So are we talking about a cognitive problem? Is there learning disability? I don't know how old the person is. Is the person asking for someone else? And could it be a component of depression? Because sometimes you find out that people who are depressed forget things. So you give appointment, oh my goodness, I have forgotten. They're not as sharp and as tip-top as they used to be. So, and that's why I always say depression does not always mean a sad face. Depression could just mean cancelling social functions. It could just mean low motivation, reduced productivity. So it's on a spectrum. So people don't necessarily have to wait till you get to that stage where they're all blank, looking very gloomy, and not showing up before we realize that there's depression. So it's a lot of things.
Titi from Oshobo is asking, what if someone is deep in thoughts and later notice her breath is not okay? Any solutions to that? Okay, please doctor, sleeping at night is difficult for me. My head is always hot. I'm confused. So you want to take, which one of them would you want to take? Yeah, you take the sleep. You are the sleep doctor. So you can take the other one, the one who is always deep in thoughts and notice her breath is not okay. Maybe I should add one more question, one more to that. My name is Katie. How can you help someone find sleep at night?
Yeah, I think it's a good time to talk about sleep. But yeah, the sleep doctor will go more about that. But experientially, I would say that, the quality of sleep you get can be an indicator of, something within your mind. We throw about this term, no sleep for the wicked, and we laugh about it. But it's not so much about wickedness or anything. I think it's really more than anything. It's about unprocessed thoughts and things that could potentially be bothering you, because what sleep really does is that it helps you to fuse everything that's happened in your conscious life into your subconscious. You process, you sort, all of those things are happening during your sleep. And then with living with a mental health condition, for me, it was every time I know that I am being triggered or I'm in a place where the stress is beginning to take a toll of me, the first thing that I see is my sleep. I sleep well. I love sleep.
Oh,
so the moment anything starts to disturb my sleep, then I know that I need to catch something. It's either something is bothering me at work or in a relationship, or there's just a trigger somewhere. So it is very important that once people start losing sleep, we can't just say, well, some people don't sleep well, some people sleep well. We need to begin to look deeply at it. We've now normalized like 4 hours of sleep. I'm a bad guy. I wake up and function all day and more, right? These things have long-term consequences, and I'll leave it for the sleep doctor to take it from there.
All right, sleep doctor, take that very quickly so we can take it.
I would just like to say that for an average adult, the recommended hours of sleep is 7 to 9 hours. 7 to 9 hours. And sleep is actually an early indicator for something going wrong with our mental health. So either we're sleeping excessively or we're sleeping less. So I think that's just what I will need to say. And nighttime sleep is the one we're very concerned about. So you don't add the 3 hours you sleep at night to the 4 hours you sleep during the day. And in some mental health conditions, you actually have reversals. So you find them awake at night and sleeping more. And especially with people with bipolar, nighttime multitasking is something we need to, it's something we need to keep an eye. So people that is at night, in the middle of night, that's when they want to clean, that's when they want to, arrange the room, that's when. So it doesn't mean, remember that I said there's a cluster of symptoms that one needs to meet before you diagnose. So the fact that I like to clean the house after the kids have gone to sleep does not make me someone with bipolar. And I also want to add that, people need to understand the concept of insight. You know, and I'm happy Hauwa said for her, she's very insightful, right? So she will know that from beginning, she knew that something was wrong. But the truth is there are a lot of people that have no insight. If the whole of the country tells them something is wrong, every other person is wrong. They are the ones that are well. Every other person is the one who is unwell. So if you have good insight, you know, treatment outcomes are usually better because you're able to take ownership and control of your
Okay, now we
health.
still have so much to take, and we really cannot take this, and we're running out of time. But very quickly, many questions still on sleep. Someone asking masturbation and mental disorders. Someone is asking lack of money and economy, pregnancy. There are so many of these. Well, we actually can't take all these questions right now, but I'll leave them just 30 seconds each and tell us your social. You are Reconnect HDMI. Tell us about what you do very quickly and your social media handles, so just in case they want to ask some questions.
Okay, Reconnect Health Development Initiative is a mental health charity. It's an international non-governmental organization. Has been in Nigeria for like 7 years, and we provide treatment support and support to loved ones of people struggling with mental health conditions and addiction issues, right? We have partnerships with different treatment centers, pretty high end, but you know, fall into world standards like Hauwa mentioned. We don't believe that anybody with a mental health condition is less of a human than any other, than their counterparts.
How expensive?
So that's the thing. Expensive is relative.
Expensive is relative. Anyhow,
Reconnect Health Development makes sure that you have quality service at affordable.
She writes woman.
Yeah, so we're a movement, a non-profit movement, a Nigerian non-profit movement that gives mental health a voice in Nigeria by really empowering people who actually live with mental health conditions to tell their own stories, co-create the solutions, and advocate for their own rights. So across social media, we're at She Writes Woman. So the writes is WRITES. That's to write. She Writes Woman, and
just for women.
No, we're not just for women, but we do recognize the burden of mental health on women, especially in our society. And of course, we run a 24/7 toll-free helpline that I believe that will be very helpful. So 0800 800 2000, 24/7 toll-free, free of charge. Speak with the counselor.
Okay, Reconnect HDI, and She Writes Woman. You can reach them on their different social media handles and their helpline. That's the much we can take on the program today. Thank you very much for being there. Next week we will do something else and very interesting too.